Welcome back to our second skill for our virtual sixth form work experience. The second skill that we're going to share with you is arterial blood gas sampling. Now, arterial blood gas sampling is a blood sample. It's from an artery as opposed to a vein, and it's one of the core skills that our undergraduates would learn. So what we're going to do is take you through step by step taking a blood gas. Okay. Now many of you may have had a routine blood sample and we need to emphasise to our patients, and our patients may have had routine blood sample, but we need to emphasise to our patients that it is slightly different, it's more uncomfortable than a routine blood sample. As I say, arterial blood gas, there are several sites that we can use, but what we're going to demonstrate is taking a blood sample from our radial artery in the wrist. So, as with any skill, what we need to do first of all is introduce ourselves to our patient. So we would introduce ourselves and confirm to our patient who we are, and also for us to confirm who they are. Quite often when we're doing skills in assessments, we have a patient with us who we communicate with, but then have a mannequin to take the blood sample from. So if I had a patient with me at the moment, what I would do is introduce myself. I'd say, hello, my name's Karen Shaw, I'm clinical skills facilitator. Can you confirm me your name and your date of birth? So we'd confirm who they are, and then we'd explain what we'd like to do. So what we'd like to do is take a blood sample from an artery as opposed to a vein. It's more uncomfortable than a routine blood sample, but it would help us to help with their breathing. Arterial blood gases are usually taken because somebody is having problems with their respiratory system, they're having difficulty breathing. By explaining why we'd like to do it and explaining how it will help them, that helps us seek consent from our patients. So we would also explain to them the risk. Now, the main risk associated with arterial blood gas is they may get a bruise at the site, they may get a small infection, or they may get, we may not be successful, we may have to have a second attempt at it. And because it's so uncomfortable, we usually encourage, when people are learning this skill, only to have one attempt and then pass it on to somebody more experienced. So once we've gained consent and our patient has agreed, we then have to assess our patient. And a nice way to open the conversation for taking an ABG is there any reason why I can't use either of their arms? If it's a lady, particularly if she's had breast surgery and lymph nodes removed, we wouldn't be allowed to use that arm. But we're also looking at our site. We are looking for any signs of bruising, any signs of infection, and also we would do a simple test to check the arterial supply to the hand. So normally you've got two arteries that run in the wrist. You've got your radial artery and your ulnar artery. Now we need to make sure that both of those are working. If I stab this one, the radial artery, and the ulnar is not working, then I could compromise the whole hand and it could become ischemic and it could die. To do that, we have a simple test called the Allen's test. Now the Allen's test, as I say, is a simple test, and basically what you do is you find the artery, and the radial and the ulnar artery, and you compromise it. So you press really hard. It's very difficult to demonstrate on this mannequin, but it's important. It's something that you could practice at home on someone else. So you press, then you ask the patient to squeeze their hand really tight, and when they squeeze the hand really tight, you'll know it'll go very pale. What you do then, when it's drained, you then release one side, and you'll see it go back pink within 5 seconds. If it went very slowly, then you would be cautious, or even not use that site to take an arterial blood gas. We would repeat that by, again, finding the radial and the ulnar artery, pressing down, asking the patient to squeeze their hand and draining the blood out. And then what we would do is release the other side, and again we should see it reperfuse, so it should go pink again within 5 seconds. Once we've done that, we can palpate and see if we can feel the artery. Now if you all want to have a go, feel for your radial pulse, you'll see a pulsation, you'll feel a pulsation, and basically what you're doing is going to direct a needle towards that pulsation to take a blood sample. Okay, so we palpate and find an artery. Okay, what we need to do then is we need to wash our hands. Infection control is a key part of any skill, because obviously we need to protect ourselves, but we also ultimately need to protect our patients who are in a very vulnerable position. So we're going to put on our gloves. Not the easiest of things to do when you've just wet your hands, must admit. Put your gloves on. And then we're going to gather the equipment that we've got. So the equipment we've got is we've got a piece of cotton wool, which is what we're going to use after. We've got something to clean the skin, and we've got our arterial gas syringe. As I say, we've done the assessment, we've asked the questions, we've checked the radial and ulnar arteries are working, functioning, we've palpated to find a suitable artery. What we do then is we clean the site. So we clean, and as I say, students from university go to very different organisations, and different organisations have different cleaning processes. However, from a university point of view, it usually says as per local policy, and that's part of our induction process, is to prepare the medical students for that placement so that they understand our protocols. What we do then is we allow that to dry. It's the drying process that sterilises that area. We then open our equipment, and in here we've got our cap, which we're going to put there ready for us. We're going to get our needle, and we need to prepare our needle, so we need to draw back the needle safety device, we need to take off the sheath, and then we need to draw back to the volume that's required. So it's usually about 1.6. We then hold it like a dart and a pencil, and then we have to palpate where we're going to put our needle. So we put our fingers over the artery, and then we direct the needle towards that pulsation. Okay, so we warn our patient to sharp scratch, in we go, and we then direct our needle towards the pulsation. That's it. So as you saw, I gently move the needle around, which is what we're allowed to do. We're not allowed to dig, but what we can do is gently move the needle around so that we can find the artery. Once we've found the artery, what we then need to do is apply this pressure. We get some cotton wool, apply it over the site, and then press down as we come out. Okay, we then make our needle safe, our sharps device safe, and we apply pressure. We have to apply pressure for a minimum of 5 minutes. Okay, it may be longer that we need to apply pressure, especially if our patients are on drugs that thin their blood, like anticoagulants, warfarin, apixaban, etc. So we may have to apply pressure, but normally we get someone else to apply that pressure while we are preparing the needle. So what we need to do is we need to then take our needle off and put it straight into a sharp spin. Okay, and then we put the cap on here. We then roll the blood gas, okay, invert it and label it. We then either take it to the machine to analyse it, or we send it to the labs for analysis. We need to be aware of our patients, what they are breathing. We are breathing air, but our patients may be on various quantities of oxygen. So we need to be aware of that when we do go to process. Okay, so once we've labelled it up and sent it off to the labs, whoever is with the patient checking the site should make sure it stopped bleeding, and then if it hasn't, continue to apply pressure until it does. Okay, we would thank the patient and then document in the notes that we have took an arterial blood gas and why we've taken it, and then await the results. The results will come through quite quickly. So that is arterial blood gases, and as I say, if you had been here, we would have got you all up to have a go at that. But it's one of the core skills that you would learn as an undergraduate, and one that you would probably use quite often, especially in acute medicine on placement. Thank you very much.